Hey everybody, this is Dr. Chris Kelsch from Avondale Health Center in Avondale, Arizona. Today I want to talk about knee pain and an exciting new form of treatment that we have in our clinic. This is right from a website, and it's actually called mykneeandknee.com. But if you look up this word here, Supartz, it'll go right to their website. This is their official website. So a lot of knee pain is degenerative. Degenerative means that the joint space becomes arthritic. So what we're talking about here, if we're looking at the anatomy of a knee here, this would be the outer part of the lower leg, the bigger bone, the inside of the bottom of the leg, and this is the big femur or the upper bone of the leg. You've got a little hinge joint in between here where you have cartilage on both sides. Now, most commonly, what you are going to see is the decreased space of the joint will start to decrease. So you'll start getting some bony arthritic spurring at time. Sometimes it can actually be bone on bone. And we're not going to get into all the detail of the anatomy of the knee, but what we will say is what happens when the cartilage of the knee starts to get smaller, starts to shrink. It can put stress on the ligaments in the knee. We already talked about the cartilage, how that can be affected. The two most common cartilages that get affected are called meniscus. Okay, there's a meniscus, something called the articular cartilage. And when the joint space starts to decrease, you also will get the tendons starting to have some issues with them as well. So tendon, the biggest example could be the patella tendon. Patella tendon is what your kneecap sits in. Be right over the top there. So that'll all get stretched out and get achy and start to hurt. Now, what Supartz is, we go to another page here. Supartz is a non-surgical, non-pharmacologic therapy for knee osteoarthritis. So what it does is, it's a three-step process. What we do is we numb the knee, which is a really simple local anesthetic, and if there's fluid in the knee, we will remove the fluid that is in there, and then we inject what's called Supartz into the knee joint space. Now, before what would happen is, and we still do this, you can inject a steroid into the knee and that will decrease the swelling and inflammation, and that does work very well, but a lot of times it's kind of short term. What the Supartz is actually a form of cartilage that's made from roosters. And they purify it, it's completely safe. It's been used for years by other doctors, and they inject it right into the joint space here, providing more cushion in there. So if you have more cushion in there, you have less pain, therefore you have more mobility, and it makes a dramatic difference. Now, traditionally, patients who get this treatment done, they need to have tried other things before. So whether that's physical therapy, chiropractic, knee bracing, whatever, they have to have tried that first. And if that's failed or it's not been as successful as the patient may like, then you are a good candidate. So if you want to get some more information, if you would be interested in a free consultation to our clinic, check out the link at the end of this video, and you will get a link for that consultation coupon. Thanks for watching.